Hello, everybody. My name is Srijay Chenna. I'm a rising junior at the Charter School of Wilmington. Today, we're going to talk about the impacts of COVID-19 on global equality. Before we get into that, a little bit about myself. I live in Delaware, a small homey state off the east coast of the United States of America, and that's where I attend the Charter School of Wilmington, one of the top STEM schools in the nation. I love research. I'm a youth member at the New York Academy of Sciences, where I've done a lot of my research. I work in complex organic synthesis in the Burchett group at the University of Pennsylvania in the top right image. In the bottom right image, I used to work at a CRISPR-Cas13 gene editing center at Delaware Technical College. And I also love music, whether it's listening to music or playing music. I play 5 instruments, and I had the opportunity to play at Carnegie Hall this past year, so that was really cool. Moving on to the presentation, when we think about COVID, we can think about it like a person with connections. And as evidenced by these vaguely humanoid concepts, COVID has a lot of friends. And its most close friends are things like physical health and societal outlook, because COVID most obviously makes you sick. And we have this new conceptual outlook of, should we wear a mask? Should we socially distance? But these lead to wider ranges of connections with COVID's more nefarious friends, like economic instability, consequences of mental health, and weakening healthcare infrastructure. And this leads to stress on the entire general population. But there's an inequality in how this stress is dispersed throughout the population. It weighs less heavily on the societally advantaged, whether that be in terms of wealth or circumstance, and it weighs much more heavily on the societally disadvantaged, whether that be in terms of wealth or circumstance. And it has some serious implications for global health, because it means that COVID may cause unforeseen disparities that neglect the very definition of global health: the improvement of health and achievement of quality in health for all people worldwide. COVID-19 has largely impacted the equity part of it. It has impacted financial inequity and healthcare inequity, and this leads to disproportionate death, disease, and disadvantage. So when we consider financial inequity, because of COVID, productivity around the world has greatly declined, and that led to a 4% global GDP downturn, which is one of the greatest economic downturns in the world since the Great Depression. So this means money is bleeding out of the global economy. So then how do you explain the 10 richest people imaged on this slide doubling their fortunes during the COVID pandemic? And the answer is, their money came from poor people, because at the price of minting a new billionaire every 26 hours, one person dies to poverty every 4 seconds in today's world. And this obvious wealth gap disparity is even more obvious when we reconsider this weigh scale and the outlook of a financial outlook. The stress on everyone is actually none on the rich. The rich are profiting off of this crisis, where more stress is placed on the poor, creating an extraordinary wealth gap disadvantage. And it's obvious that this connects to global health, because global health is also concerned with some basic necessities that are required by wealth, things like getting access to food, healthcare, and shelter. And you can't do this without money. So the financial gap poses a significant inequality in addressing global health. Moving on to healthcare inequality, largely when we think of healthcare inequity in developing nations, we think about this stereotypical image, like these 6 images here. And unfortunately, these images are largely true, because the majority of people in developing nations cannot easily access modern healthcare facilities. And this means, while they already have struggling healthcare systems, they're being battered by COVID-19 and they're unable to recover, making their healthcare infrastructure and systems more vulnerable in the case of a future pandemic or healthcare crisis, where well-off nations and generally well-off groups are more adapted to recover from this and improve from this, while less advantaged systems are made even more disadvantaged, widening the inequity in healthcare systems. But this is focusing on developing countries as a group. It's also possible to understand healthcare quality as an individual based upon circumstance, rate their ethnicity, and wealth. Because these 3 things can cause a predisposition to comorbidity, lack of access to healthcare, access to sufficient healthcare, social isolation, or financial instability. And we know that COVID-19 can have some serious effects with comorbidity, especially if you're immunocompromised. Lack of access to healthcare, insufficient healthcare can mean you don't get treatment for sickness from COVID. Social isolation can have serious mental health implications, and financial instability can cause that lack of access to healthcare or insufficient healthcare. And this means the susceptible populations are disproportionately affected by COVID-19 in obtaining safe and quality healthcare. And this inequality is again detrimental to global health when we look at it on a clinical individual basis. And inevitably, all of this leads to disease and death. COVID-19 can lead to economic instability, which can lead to weakened healthcare. And this obviously leads to disease and death when sick individuals can't obtain the proper treatment. Lead to global instability, especially in developing nations, which can disproportionately lead towards disease and death. And this web here is only a small representation of the far reaches of COVID, the main impacts. If we were truly to draw out the niches and the nooks and crannies of this whole map, it would span for miles, but eventually it would all culminate in disease and death in an inequitable manner. In conclusion, there are a few takeaways I want everyone to understand from this presentation: that equity and equality is extraordinarily important for global health, and that equity is in danger right now because of the COVID-19 pandemic. And it's important the world addresses this by building back equitably in order to make sure that we don't face a similar crisis going forward. As to what you can do, I'm sure everyone who's watching now is going to go on to accomplish great things in their lives. So when you're doing those things, I want you to keep equity in mind. Whether you're a financial broker or a healthcare worker, keeping equity in mind in your day-to-day activities can significantly improve equity because it influences your thoughts and your decisions, and this can slightly improve global health. And if we all slightly improve it, it'll eventually get a lot better. So essentially, equality is important, and that's in danger, and we're overlooking that largely right now. And it's important to understand that and address that. These are some sources that I use directly in my presentation, and I would like to thank the Global Health and Leadership Conference at JHU for giving me the opportunity to speak here. And if you have any questions, feel free to contact me at the email on the screen. Thank you.